guess I could respond to one thing. I don't think we're the richest country in the world. I think some country in the Mideast has that Dubai. Okay. We're not the richest country in the world. In fact, we're in a deficit. Let me tell you, the government gives, the government takes away. Everybody in here is on Social Security. And how many people are on Social Security? You guys realize you just got a cut?
Yes.
How come? They took it away from you. And the way they cut it was, they added to your Medicare because it's illegal to cut your Social Security. I'm going to tell you a story about my daughter and my granddaughter. I have cystic fibrosis. I've dealt with the medical industry all my life. I've had a double lung transplant. I've had a kidney transplant. I've had my lungs, my esophagus removed. I've had great health care, and I realize a lot of people don't. We're all trying to get to point A, but we all have a different way of getting to point A. I was on a board for the state of California for a genetically handicapped person, and you have to show a benefit for what it'll do before the state will pay for it. If there is no benefit there to where they're going to save money, they're not going to pay for it. It comes down to cost. And I'll give you a perfect example. My granddaughter was just denied her health care medicines through the state of California. Her medicines run on an annual budget of $35,000. Now, my daughter, she makes $36,000. So that gives her $1,000. Now, you'd think I'd be for it, but the problem is they're going to take stuff away from you. And they say, well, this isn't socialist. Karl Marx said, once you can get into the health care, in control of people's health care, you can control the rest of their life. What we need to do, we all want to get to point A, and everybody likes something for nothing. I'm going to give you another thing that I know for a fact happened. Just one real quick thing. One real quick thing. Somebody mentioned the illegal aliens, and there's a farmer out here that has a bunch of people with green cards. He pays $500 a month for their health insurance. They don't use their health insurance. He wouldn't ask them why they don't use the health insurance. You know what their answer was? If I go to use my health insurance, I have to pay a deductible. I have to pay a copay. But if I go in there not being an illegal, it's free. And you and I and everybody else in here are paying for it. And you want to cut costs.
My comment is in a similar vein. There is not the capital here to pay for this. Yes, many of you here are on Medicare. How many of you know that that system is due to be broke in less than 10 years? Yeah. That's what it is now with the limited number of people that are on it. You expand that well drains up much faster. You cannot sit here and have everybody on the same system. It's already proven that private insurance actually costs less per patient than government insurance. It's true.
I can tell you that's not true.
It is true. Name one government program that doesn't cost more and it ultimately starts out with.
Well, of course they cost more than they start with.
Yes, but the point is, everything, if everyone ends up on the same plan, guess what? Everybody's going to pay into that plan. Because the same number of people are paying it now, you all who are paying your medical, or getting your Medicare now, you're not paying for it. I'm paying for it. When you worked, you were paying for the people who were on it then. If you put everybody, or give everybody the option, my age, to get on it, guess what? We're now paying for it. My care and your care. And guess what? Both of us are going to get less care. Thank you.
Well, I don't know about the less care because I ain't getting any at all right now. And I just want to clear something up right now. Those illegal aliens, they're human beings. Now, I'm 58 years old, and I don't have any insurance, and I'm a blessed person because I'm healthy almost every day of my life. And lucky me, But I would like to defer my last minutes to the man that's sitting behind me because he isn't lucky. He's not healthy. My sister, I won't tell you what political affiliation she's with, but she said to me all along, she says, oh, you went into self-employment and you don't have the insurance anymore. Oh, la, la, la. I said, you don't either, Debbie. You have no insurance. So she gets breast cancer. Her husband has a heart attack in the same month. But you know what she found out? She didn't have health insurance either. She paid into it, and the truth is the 20% after a coronary attack in a hospital in an ICU unit for a month and breast cancer, 20%. Oh, gee, that's a couple of $100,000. She didn't have that sitting around. So they declared bankruptcy. My blessed sister declared bankruptcy because they didn't have money. I'm telling you.
I want your time.
I don't have you got it. You got it.
How many here have 2 years to live? How many here have 1 year to live?
We don't know.
All right. I'll talk to you. I'm talking about end-of-life directive. That seems to be a big thing. That we sit down with our physicians and talk about what happens. I don't know what this man thinks, but have you talked to your physician about what you want at your end of life?
Sure. I have not talked to my doctor. No, I have not.
You haven't.
No.
And how do you think this is going to come out if you don't talk about it?
It's your decision.
Your decision not to talk?
It's your decision to do what you like to do. That's it.
Well,
You don't need to talk.
okay, but there's a history to my family. My cousin, my wife's cousin, was Richard Nixon and Gerald Ford's personal physician at the White House. And he's been working on end-of-life decisions. And his folder is very thick. It's not easy to do. We need to come to terms with this. My father-in-law's wife, my mother-in-law, was a multiple sclerosis patient in severe handicap for 40 years. I come from a family that was wealthy and educated. I'm wealthy. I'm retired. My kids are taken care of. What's going to happen to you when you get old and it comes to end-of-life decisions? You know, you had better. You had better. There has to be a program where we come to terms with this. If we don't come to terms with this, there's absolutely no first step.
So what, you're asking for a death bill?
I'm talking about we all die.
The death battle.
Oh, I'm sorry. You know, we're all going to die. We need to come to terms with this. We need to talk to our families. We need to talk to our doctors.
It's not the government's turn.
I'm not talking about a government decision.
Why does it have to go in a building?
I'm saying
Why have to put it in a building?
we need to talk to our doctor. We're talking about
The government doctor have to do it when you die.
Get the money.